Most people probably don't know that 20 to 25% of our kids have some sort of mental health or behavioral health issue, whether it's autism, whether it's ADHD, whether it's an eating disorder, depression. Without data, it's really uncharted waters. So these studies, this data is really powerful to point us in the right directions on these things, but also to educate people about what the magnitude of the problem is.
We looked at the percentage of pediatrician visits that resulted in some kind of behavioral health diagnosis. These are things like ADHD, depression, anxiety, and we saw a very significant increase in behavioral health diagnoses.
I think that the data really help us put things in perspective. And the data that we are using about the national trends also help us put our kids in that context and know what is really going on.
These graphs are just probably the tip of the iceberg. The directional trend is very disturbing, but also the magnitude is disturbing, and these pediatricians are swamped.
So pediatricians really are facing growing pressures in their practices. They find themselves working a lot harder just to maintain their current income level.
That's why we need to do more research. We need to have a better system that in terms of more providers. We need to be able to pay the providers a reasonable amount for the care they're giving. But I think if we do all that, we're going to have a huge impact for these kids and families.
Our data structures look a lot like the country as a whole. Our physicians are in every state. The patient populations that they're treating look a lot like the United States population as a whole. We call that healthcare in the wild. It really looks like community medicine that is, as it's practiced on a day-to-day basis, to the vast majority of Americans.
We're on the cusp of something really huge there, and it's kind of like big data and big analytics that are going to really revolutionize how we can identify these trends or get specific about certain diseases that might be rare. I mean, autism might be 100 different rare diseases that are all rolled up into one. We won't figure that out unless we have the analytics, all of the really sophisticated capability of probing into, is that patient like that patient, is that child like that child? What made them more similar?
We need to figure out what is making, what is leading to this kid, 30% of US students to feel sad and hopeless for the last 12 months. And of those, 40% of the girls, what is going on? So we need to get to the root causes of these things and try to identify and then figure out how to prevent.
We can shorten that time to diagnosis, increase the diagnoses and shorten the time to treatment. We can turn a lot of this around. So that's the hope. And that's the hope in the data, is that you can identify these things and then you can intervene early.